Good morning, everyone. Welcome to this Q&A clinic on the post-authorization procedures in IRIS for the industry users. My name is Sara Santos. I work with the RPM team on the transition of these procedures. I'm here together with Madalena Mario. She's a product owner for RPM. So once again, welcome. Just a note for you, so this session is being recorded. We'll make available the recording through YouTube so that you can rewatch and share the session with your colleagues. So the purpose of these sessions then is to give you an opportunity to ask your questions. So we'll do so via the tool Slido. So you'll have a QR code here that you can use to join the Slido to ask your questions so that we can answer them. So I'll give you a minute or two for you to start logging in, and then we'll move to the scope of this session. So just a minute for you to log in and to start typing in any questions, any clarifications you might need. So in the meantime, just to talk a little bit about the scope. So as you know, from January 2025, we have all submissions sent on or after 20th December 2024 via the current system. So Gateway or PSUR repository will be managed in IRIS for the post-authorization procedures, which are listed below. So we're talking about the variations, both on the human and veterinary domain, Article 61.3 notifications, the marketing authorization transfers, PSURs, PAMs, annual reassessments, the referrals, PAS and PMSS, line extensions and renewals. So all these procedures from next year will be managed in the new platform, IRIS, although the submission of the dossier, the VNIS or the ECTD will still be done via the normal process. So you'll still will be using the Gateway, or for the PSUR, also be using the PSUR repository. Here are some exceptions for you to take note. So the periodic safety update reports will transition to IRIS with the procedure starting on the 6th of February 2025 and onwards. So as per the PSUR procedural timetable that is published on our website. And also the companion diagnostics, which have different procedures, will stay in SciMed, so our current database and our current process. So they will stay in this database SciMed if they are received. So these types of products, these companion diagnostics, are still not going to be transitioned for next year. So again, the purpose of this session is to answer any questions you may have on the transition of these procedures to IRIS during the next year. Please also note that we have scheduled some future sessions, some more Q&A walk-in clinics for you. These are listed here. So you'll have one on the 19th of December, another one on the 8th of January, and a third one on the 17th of January. So here I'll go to the next slide where we will wait for your questions to come in. All right, and we have one already. So please, can you confirm whether the PSUSA assessment report that will be accessed via IRIS will also be notified via email? Will an email be sent stating there is a PSUSA assessment report in IRIS, or does it rely on MAH monitoring IRIS until a PSUSA assessment report is available? So in IRIS, once we share any document, and that includes, of course, the assessment report, So every time we share documents with the MAH, you will receive, or the submission contact will receive, an email communication alerting of this. So this will prompt you then to go to the portal to check the documents from EMA menu, where you'll find those documents, including this assessment report. Second one, so if there are multiple managers assigned by an MAH, however, only one of them is registered as a contact, then notification would only be sent to the contact point, but the case would be visible to all the managers. Is it correct? Correct. So we only send our notifications, our email notifications, we send them to the submission contact. So indeed, in your Outlook, you would receive only the submission contact would receive this communication, whereas in the portal, if you have multiple managers, all those managers would be able to see the case details and the documents through the portal. But indeed, they would not receive the email communication, so only the submission contact receives that communication. Please, can you demonstrate accessing SUSE assessment report in IRIS? Indeed. So any document, and including the assessment reports, are accessed all in the same way. So you'll have the same process for all procedures. And I will just quickly go to the IRIS portal. So here I am in the testing environment. Let me just zoom in a little bit. So once you are in the home page, you would go here to your submissions menu and to your ongoing submissions, which then gives you an overview of your ongoing cases. So once you have that view, you can, since the question was about a PSUR, I will further filter to a PSUR case, but please notice it's going to be the same for all process types. So to access any documents that EMA has shared with you, you would go to your case. So here, for example, I'm opening here the first one. Here on the right, you have this arrow pointing down. You can click on it, and you can click View Edit Submission. This will take you here to this submission form menu, and you'll see that you have the documents from applicant and the documents from EMA. So if you're looking for the assessment report which the EMA has shared with you, you would go into this menu, Documents from EMA. Now, I don't know. So for example, yes, here I have a test document. So let's imagine that this is the assessment report that the EMA has shared with you. And once you click it, the system will prompt you to either open the document or to save it in your local drive. So this is how you access your assessment reports and other documents that EMA would share with you. Okay, going back. So in all webinars we recently attended, regardless of the specific topic, it is said that generic mailbox will be no more accepted. How, from technical settings, I guess, EMA will identify generic mailboxes? Is there any specific EMA guideline?
I can take this one. Good morning from my end also. The generic mailboxes are identified at the account management stage, and this is I would not know the specificity, but the generic mailbox actually means a mailbox which is accessed by multiple users, and the account, let's say, is not individual. So a person on individual email box means only one user has access to it, and also to the respective account. So that's, but I guess that is clear already. And technically, it's really a security setting. I would not really, we would not know how to tell you what are the checks, but we are. If it's not clear what a generic mailbox versus an individual mailbox means, we could repeat that, definitely, just for clarity. And then there's another one. What is the rationale between the prohibition of using generic mailbox addresses, IT security issues, GDPR compliance? Yes, this is correct, both of them. So the criteria, it's mainly on GDPR compliance, and it's well, it poses a security issue. Hence, has been reinforced to use the individual email addresses and accounts. Okay.
Thank you, Madalena. We'll continue with will the MAH continue in some cases, like pre-opinion, to respond by UltraLink? Or will it have to be via IRIS? Same for the PI at opinion at +5 or +25. Indeed, so any working documents that you would by the old procedure send via UltraLink, now we are asking that you send them through the IRIS industry portal. And indeed, that includes your final PI at day 5 or day 25. One note here, so if your procedure is going for linguistic review, please note that the initial state, so when you share the translations with the member states, and when you receive the comments from the member states, so those steps are still done, let's say, outside of IRIS, as per current procedure. It's only at the final stage at when you do have the final translations, then those should be sent via the IRIS industry portal. So yeah, indeed, anything during the procedure that you would send via UltraLink, now you should send it via the IRIS industry portal. So who is the first submission contact? The one in the EAF during the procedure with LOA, or the post-authorization contact?
Can I take this one? Then the first submission contact, it really depends if you are talking about a centralized, centrally approved products or a procedure with nationally approved products. So if you are talking about procedures with centrally approved products and about centrally approved products, the default and I'm assuming you're talking about variations. The default person as a contact is indeed the post-authorization contact. So you don't need to submit an LOA, and in the EF you should really state this portal contact as the product contact as your EF contact, and later on, after you get the notification that the procedure has been recorded in IRIS, which is an automated notification, you can go, you'll receive instructions via email, and you can go on the portal and add contributors, managers, and change the contact if you wish so. Thank you.
Yeah, thank you, Madalena. So for sharing any document via IRIS to EMA, there is no need or provision to select multiple email IDs. The document can only be browsed as a zip file and uploaded with a click. Once uploaded, a green tick would show up. Is this correct? So indeed, so when you are uploading a document via the IRIS portal, indeed, you're not using any email. And maybe I can give a demo on this. So going here in my previous case, this PSUR case, now as an industry user, if you would like to share documents with EMA, you would go here on this documents from applicant menu. And the way to do it is you would have a file, so you can upload Word files, you can upload zip files. We have some guidance on how you should upload files here in the IRIS industry portal that you can consult. So for example, we're advising that you normally upload the files individually, and we're recommending that you use the zip files only for the final translations of the PI. But anyway, let me grab a file that I could use. So the way to do it is you find your file, and either you can use this Add Files button, or you can just, here it is, choose Files, and then let's say, let me put something here on this drive. So you find your file, you select what you can select multiple ones as well to open. And here you have the option to add files. So once you have all your files uploaded, let's say your package of documents, you can come here to confirm that yes, you have all the documents you want to upload, and then it's just a quick save and return. So this will prompt the system to send an email notification to us at EMA to the case, and indeed you'll see here this green tick box that that appears once you upload those documents. So going back to the presentation, can you please clarify step by step what documents goes in ECTD gateway IRIS? It is not clear, as some documents will have to be put back in ECTD closing sequence or not. So the clear distinction is any official document part of your dossier should go in ECTD and should go through the gateway. In IRIS, what you would send would be any working document, for example, any working PI that you have made comments on during the procedure, and there's a bit of back and forth between EMA and the MAH. Also, for example, could be a working EPAR where EMA sends to you that EPAR for you to check and to comment, and then you send back the same document with your comments. So any of those working documents, official documentation, part of your dossier, and part of your ECTD structure, or your VNIs for the veterinary procedures, those are sent through the gateway. Can you please detail the PMS fields that are necessary for the IRIS portal communications after a PSUR submission? Only product needs to be available on PMS to be able to access to the IRIS documents, or any other field? Thanks.
I can take this one. There's no difference, so the rules should be the same as you have it for the electronic application form, for the web form. And you should be, of course, affiliated to the same organization as the marketing authorization holder for that product. So the rules are the same. In order to add, for example, a product in a variation in EAF, you need to have a certain affiliation. That would be the case also for PSUR or any other procedure, let's say referral. You do need to have the same affiliation to be able to, so that we can make the connection between let's say the product, the marketing authorization holder, and yourself as a contact. So that also includes nationally approved products. So that for centrally approved products, it's way easier in terms of it's more straightforward. But for nationally approved product, you need to you will indicate contacts right at the submission of the PSUR, and that contact which you indicate when you submit the PSUR will be the portal contact. So you need to take that into consideration. Also, I will extend maybe here, and because it will maybe generate other questions. In case of a referral, depending on the type of referral, we are using either the qualified person for pharmacovigilance, so the QPPV, or a contact which you have stated that your national competent authority. These contacts will need to have an IRIS account in order to be able to collaborate via the IRIS system. So PSUR referrals, passes, PMSS, the contacts indicated for these procedures, irrespective if they are centrally or nationally approved products, they would need to have an IRIS account for that, and the product let's say details I've mentioned, they should be the same conditions as you would need to fill in an electronic application form on the PLM portal.
Thank you, Maria. I'm sorry, but due to the complexity of settings of the mailboxes at complex organizations, we'd ask you to reply in writing covering all aspects. Example given, if the mailbox has a single owner, but the name of the mailbox is generic, for example, EU QPPV. So I guess this is a request.
I would maybe inquire you to ask this question via the Ask EMA. To be honest, the criteria of having a personal mailbox are clear. You need to be an individual with an individual email address and an individual account. However, if there are kind of these exceptions, I would really go and ask via Ask EMA or with pointing on EMA account management. And have the clear response there. Maybe it's a good idea to do so. I understand there are exceptions, but I would not be able to provide you now a response. Maybe by next time, I will try to get your response on this question, because we have few days before next week. But I would also encourage you to ask it via the IAM Ask EMA channel. Thank you.
Thank you. Okay, so is possible to have a multiple contact person in a submission? The answer here is no. So we will always have one submission contact who we will send the correspondence to. At least for these procedures we are in scope for this session. Is there an expiry date to access documents from the EMA in IRIS?
As far as I know, not, but you should access your documents. Basically, the fact that we have a designated space on IRIS for having the documents shared means that you have received them, and if you have I don't know, legal deadline, for example, that starts on the moment the documents have been placed in that folder. So if you have, for example, a re-examination, or you need to provide responses for PSUR when you have 30 days, I believe, then yes, you should consider downloading them as soon as possible. However, if you just have an opinion for a variation, which is straightforward, let's say, and it will take a while, the documents are being there waiting for you.
Thank you, Marie. Is there a button to download the entire case after completion, all comms and docs? So for the communication, of course, the communication is received in your email software, right? So the email notifications won't be visible in the industry portal. And as for the documents, you can download them as I've demoed before through that menu on the documents from EMA. What you can also do is to download a view of your ongoing or completed cases view. So what you have, and let me go to the portal. For example, here in your ongoing submissions or your completed submissions, you'll have this download button, and this will provide you with an Excel file of the information you have here. So this is what we currently have available. How can I match my procedure and IRIS case number? Is the IRIS case number the procedure number now? How to not get confused if parallel procedures are running on the same product? So indeed, we have a unique case number, which we consider our procedure number, yes, for a certain procedure. Please note that in all our communication, we always try to identify minimum the case title. So also every time we create a new case and we expose that case in the industry portal, the submission contact will receive a email notification with the case title for their reference, so they can use it in further communication. And indeed, in all our communication, we always try to have minimum the case title, and then we might also have, for example, the product name, and so on. So that's how you can keep track of your procedure and not confuse it with other ongoing procedures. It will be very useful to have clarity on where emails filled in the EAF either populate fields in IRIS or UPD in veterinary.
Can I take this one? As mentioned before, we will have an info button on the EAFs just to make sure that it's clear that for centrally approved products, variations, because that's what we are talking on the EAF. So centrally approved products variations, the contact will be the one of the product or the one of the centrally approved products parts of the variation. And in case of work sharings, you do have guidance in the letter of intent to EMA that you need to select a lead product. This means that selection of that lead product will get the contact for the procedure, for the case on the IRIS portal. And that's irrespective of veterinary and human. So I think, I don't know, Sarah, if you have something to mention about UPD, but since vet procedures and human procedures are managed in IRIS, except for the VNRAs, but that's something, I guess, separate, right?
Exactly, that will be specific for UPD, and it won't affect IRIS or the marketing authorization holders with IRIS. Okay, thank you. Is it mandatory to have IRIS account for colleagues from regulatory affairs team managing products?
Only if they are contacts for a product as a centrally approved product, or if they are set as contacts to an NCA in the eventuality of a referral, if they are a QPPV, and there would be, for example, for safety referrals, if I am not wrong, for human domain, we take as default the QPPVs for as a contact. And yeah, that's pretty much it, I think. And if you state yourself as a, or if the users which are stated for PSURs as contacts as well. So, well, this would be, IRIS would be more or less like the need to have a UDRA-link account or even more than that. So it's something we need to communicate widely, that if you are connected in any way or possibly connected in any way to a procedure which will be EMA-led, you would need to have an IRIS account.
Thank you, Madalena. Will IRIS accept distribution email address and rather than a generic mailbox address?
I'm not sure what distribution email address means, but I want to clarify also the issue the practical issue with a generic mailbox. If you are using a generic mailbox, even, I don't know if it's missed, in practice it won't work, because even if we will, if it wouldn't be for GDPR and any other security policy, a generic email address will receive this notification from Iris. However, any of you, and this generic email address would be the contact for your procedure. Any of the users accessing those links won't be able to access the case and the documents, because they are not set as contributors or managers on the case. So in practice, this won't work anyways properly, and this will trigger a lot of questions and issues, because people are not going to be aware between the difference. Yes, I get an email with the instructions, I go and I check, and I don't see the case and the documents. So it's really not even a practical way of working, let alone the security and the GDPR policies we have in place. So I do not really understand. I don't know, Sarah, if you have an explanation of the distribution email address, but if you don't, maybe we can ask the user to clarify.
Yeah, to further clarify, I understand it could be indeed some sort of email address with multiple users. I guess that's the whole issue of the point. And indeed, your advice is correct. But if it's not clear, maybe we could ask this person to maybe have a follow-up question. Can you please remind us how to change a generic email address, and until when should we do this change?
So there are 2 points. If you have a centrally approved product and you want to change completely the contact of that product, there is a link on the website. It's how to contact EMA and how to change your contact person for the centrally approved products. Now, if you are a NAP contact, or you just want to change your email address from a generic, so it's your name, let's say it's me, Madelina Duțamare, and I want to change I'm a contact for product, I don't know, some product A, then but the email address I have, it's regulatory@company.com, and I want to change it to my personal email address. The contact remains the same. So the name remains the same, but the email address will change. You need to do that via the EMA account management system. We did send some emails widely, even to the nationally approved products qualified person for pharmacovigilance, so to the QPPVs. We are going to send you another communication just to make sure it's clear what are the procedures going live and what are the timelines, and you'll get instructions in that email. So if you are an EMA, a centrally approved product contact, and you want to change just the email address, it's still via IAM, so the EMA account management system. If you are an app contact and you want to change your email, it's the same. But if you want to change completely the name, so basically the contact for a centrally approved product, then it's via the EMA website. There is a guide there how to change. Is you get a little form with the information, and we're going to email this to you as a reminder. We are preparing communications for the contacts we have, all the contacts we have available around the systems.
Thank you, Madalina. Iris is not a messaging tool. How can it replace UltraLink? If we want to send a quick message, do we need to write it in a document? So here, we are advising for documents that you send them through the portal, the Iris Industry portal, but indeed, if you need to send messages, you can use your usual tools. So from the beginning, when we expose the case to you in the industry portal, you will receive an email from us. So from there, you have the necessary information for you to send us an email back if you have questions, or if you need to write something ad hoc for the procedure. So you should use that beginning email to get the information you need, referring to your case title, the IRIS token, so that sequential number that we have in the email subject, so at the end of the email subject, plus the IRIS email. So those you can use to communicate with EMA. When we submit the procedure in eCTD, we only need to send via gateway, no need to also send via IRIS. Yes, that's correct. So for these procedures that I mentioned in the beginning of the session, and you can also take a look on the slides once we share them with you. So for these procedures, indeed, you only need to send your or submit your procedure via the eCTD or the VNIS for the veterinary procedures. Could you please summarize the scope of IRIS portal usage by MAHs of nationally authorized products within the EU? So for MAHs of nationally authorized products, the usage of the IRIS portal is only applicable for procedures where EMA is leading the assessment. So this could be, for example, a referral with only NAPs or PSUR, for example. So those procedures where DMA is leading, where you have NAPs involved, then you as a marketing authorization holder and as a contact for that certain product should have a IRIS account and should have access to IRIS. So then also you can use the portal to look at your procedure, to send any working documents, and also to receive the documents from the EMA regarding to that procedure. So will responses to PSUSAs still be made via the EMA PSUR repository? Here, Madalena, maybe you can help
us. Yes, because it's an eCTD, so everything you send usually via eCTD, you will send it also in the future, so that doesn't change. We are using IRIS for the regulatory procedures in the post-authorization context now, only for exchange of documents, which will usually be sent via UDRA link. Whatever is sent today via eCTD, that's going to be the case also in the future.
Thank you. Where can we see all contact persons and their contact details registered for a CP, also for quality defects scientific service? Will this be visible in EMA systems for companies? So
for the time being, it's not visible. We did send each of these contacts for centrally authorized products. We send individual emails with the role and the product they are they have a role for, and this was meant to serve this purpose, so that you identify these persons and centralize the information and organize it internally. In the future, this we do not have anything on the roadmap, but there are now design efforts and planning to see how we and what information could we expose on the IRIS portal regarding the products. But of course, we need to have our technical colleagues look into the details of this.
Thank you. Can more than one contact person be assigned to a variation procedure? So no, for variations, we only have one contact person or submission contact at a time. Of course, throughout the procedure, you are able to change it through the portal. Can we have access to previous and completed submissions where other people were the manager, but they are not in the company?
I can take this one.
Mm-hmm.
Yes, you have, I think it's called the industry coordinator, one of the roles, who can assign a case also to, or see the cases and assign them to someone else. But what is really advisable is to have more than one contact on more than one managers or contributors to a case, so you don't run into this problem in the first place.
Mm-hmm.
Right?
And that's correct. Why is necessary to update generic email also in XEVMPD? What is the deadline to do this?
We were mostly, emphasizing on any person who could be a contact. For the nationally approved products, we said that it's, what was it, end of the year, I think, the latest.
Mm-hmm.
They should be, but more important, or equally importantly, is to have an IRIS account on these emails. Because otherwise we cannot create this space on the portal to collaborate on the procedure.
Thank you. The QPPV is the contact person, responsible person for an app. However, the submission of the PSUR is the regulatory department responsible within our organization. Please advise how the IRIS should be managed for this NAP.
The PSUR is not really connected to the QPPV, so if you point a contact from the regulatory department when you submit the PSUR, only this person needs to have an account, or will be used, or their account will be used for this submission. However, if we have a safety referral on the human domain, let's say that's the process we have, we are recording the QPPVs as a contact by default for this product. So for that reason, you will be as a QPPV contact, and we would need you to have an IRIS account for that.
Thank you. Why the contact person for receipt of EC decision, the 2.4.1 in the EAF, have to be registered in IRIS and have an individual email address, as EC commission will still be received via Ultralink EC and are out of scope here?
It's just a practical reason, actually. We do not have yet the setup technically in place for the EC to send you the documents via IRIS. So that's something we are looking into. But that's the simple answer. We do look into this, so in the near future we should have a setup for that too. That's why we also encourage the contacts for the commission, the marketing authorization holder, to create IRIS accounts as well, because this change will come also soon. We'll inform you about that, of course.
Thank you. Only the contact person will receive a notification by email, but who and which role in IRIS will be able to download the documents? So I'm guessing any user that is a contributor, a manager, will be able to download the documents. Indeed, also the coordinator will be able to see that information. So indeed, those 3 roles will be able to look into the documents there are in the IRIS portal. If the PSURs are submitted via the IRIS portal, they will be outside the ECTD structure of the dossier, correct? Then a cover letter will still need to be attached, but without specifying any sequence number?
We need to clarify this very often, I think. The submission and the ECTD format will not change for any of these procedures. Only the case management will be carried in IRIS for the regulatory procedures. So the product life cycle, and this year only the post-authorization, we use IRIS as a case management and collaboration, but it's not a submission portal. This needs to be very clear, and please, if it's not clear, send us questions via Ask EMA or in these walk-in clinics. The submission remains via the gateway or the repository, and in the respective format, ECTD or VNIS for the vet products.
Thank you. Please, the generic contact email for QPPV should be modified in XEVMPD for all products. What is the timeline?
As mentioned, end of the year, because we may have, I don't know, some emergency procedure, hopefully not. And if you're a QPPV and EMA will have you as a default contact, we do need to be able to collaborate on the procedure. We have sent you an email to inform you on this and what is the process. It's usually via IAM because we need you to have an account and to have an email which is not generic.
Thank you. How to update contact details of ISPOC in IRIS portal?
I think there's a confusion here. We are not talking about ISPOC. That's a notion, I believe, about the shortages and their ESMP landscape. We do not update any contacts on the IRIS portal in the case of a product. That's going to be done via the EMA for the centralized procedures via the EMA website and the form you have there. And for the contacts of the procedure, so once a case is created, you receive an email, and then you can change the contact of the procedure from the portal. I don't know, maybe we could demo a change in the contact on the procedure which is already created in IRIS. So on a case, if we have some time, Sarah.
Mm-hmm. I can quickly show you. So in your portal, and again, I'm here in the ongoing submissions menu. So you'll see any of these submissions, you'll have this arrow pointing down. So this is where you can change your submission contact. So clicking, you'll have a menu with the current portal contact. You can come here to change submission contact, and then you'll have a list of people. Of course, this is dummy data, but you'll have other possible persons that you could select and then change that submission contact for the specific procedure. Okay, going back. For PSUR submission, I need to submit it on the EMA gateway and create a submission on IRIS, correct? No. So you will only need to submit your submission, your PSUR submission through the gateway. So in IRIS for these post-authorization procedures, the ones that are in scope for this session, you won't need to create any submission in IRIS. So the submission or the case will be created at the beginning by EMA, and then it will be exposed to you in the portal. So no action in terms of creating submissions in IRIS for these specific procedures. Thanks for clarifying that the email address can be changed in IAM. However, the change is not possible in Edit Identity section. Could you please inform us on how to move forward? The contact is not to be changed, only the email address.
I would raise a ticket to service desk if you face any issues with that.
Okay, thank you. On EMA website, it is stated that the official contact person for PSUR procedure is the one provided in the XML delivery file. How can we update the contact person included in the XML if MAH has not added a personal email address?
So if you have, and it's correct, this is what we mentioned, that for PSUR you indicate the contact with the XML delivery file. This contact has to be an individual email address with an IRIS account. If you wish to change this person, it's only possible after the submission is created. Then they will receive an email and they can go on the portal and change in the way Sarah just demo, change the contact of the respective case. Now, if the person is no longer available due to some emergency absence, there's always a company coordinator for these IRIS accounts who could grant access as a contact to another person with an IRIS account, of course, and with the right settings. So the company of this person should be the same as the MAH of the product in order to be able to find this person in the list for adding them as contact. And maybe something important, a contact is always a manager role in terms of IRIS roles.
Thank you. Can you please detail how to handle RFI from MA to MAH during the new MAA application or lifecycle management? I understand the submission is done via ECTD gateway, so that's correct. Also, the submission of your responses should be done via the gateway, so not through the IRIS portal. Apart from not having general email contacts, is there any other task that the industry should take into consideration if they only have NAPs? Thank you for your time.
The other mandatory condition is that you have an IRIS account with a manager role for these contacts. Otherwise, the portal space won't be created for this product.
Thank you. Request how to download all documents of a specific case. So as I demoed before, maybe I can go back to the portal here in my submissions, and maybe I can grab that PSUR from earlier. So here, again, on the right side, where you have your view edit submission, then in documents from EMA, you click on it and then it will prompt you to save the document. I don't think at this time you are able to select multiple documents for a bulk upload. So it's document by document at this point. Going back. And then I guess we're answering one more question. We're 4 minutes before the end time, so we'll answer this last question, and then I'll open the survey that we'd really appreciate if you could complete. So one last question. All validation issues will be received via Iris, or will we still receive sometimes via email, as we receive sometimes by UdraLink? So any communication, if it's in terms of documents, if you receive this validation issues as a document, this will be sent via the Iris portal. So that's where you'll go to look at those validation issues. You'll also receive an email notification from EMA. So every time we share those documents, the submission contact will receive an email and notification. Okay, as we are 3 minutes away, I would please ask you to fill in the survey that we have.
Can we also take the one on the SMF, Sarah? Maybe it's a good one.
We can.
Yes. So is it correct that the responses from ESMF holder or CEP holder during a procedure will also go through IRIS? Do they all need roles as the marketing authorization holder needs to have for a procedure? I think the CEP holder is not really something we are dealing with in terms of variations, but we are because the marketing authorization holder mediates this via the certificate. But for the ASMF holder, is it true? We do not really have yet the setup in IRIS. So we will send them UDRA links for the time being. You as a marketing authorization holder for a variation will receive the documents via IRIS, so your applicant part and the assessment report. However, the SMF holders will still receive the UDRA links. And of course, when you submit the responses back via ECTD, is going to be done via the ECTD as per today. But it's a very good question, and thanks for asking it.
Okay.
And sorry, Sarah, to interrupt.
Thank you. So I have the survey open. So please, if you spare some few minutes just to quickly give us some feedback, so also that we can improve. And indeed, in 1 minute left, I would like to thank you so much for coming to this Q&A clinic. We hope that it was helpful to you. Yeah, see you in the next sessions. I can also pass to Madalena if you want to say anything else.
Well, I also want to thank you for your time, and I hope you advertise these walk-in clinics to your colleagues as well, so we have as many colleagues as possible in this session, so we can clarify our questions and of course use them also in the future for Q&As. Thanks also for filling in the survey. That will help us prepare better and to have the session more suited for your needs. And looking forward to see you in a week's time also.
Thank you so much.
Have a nice day.